So I head up healthcare worldwide for Zoom. I'm really honored to be on this call today. And just to talk a little bit about, well, my background, I was actually a U.S. Marine. I have a bachelor, I got out and I have a bachelor's degree in nursing. And I worked in a large telemedicine network in the Northeastern United States, which is where I'm located now. So I live in a state called Maine, which is very rural. So I can really understand, some of the geographic challenges we have as we don't just have a shortage of healthcare providers in many cases, regardless of where you're at around the world. We have a maldistribution of where the providers are located in the larger urban centers. And in many cases, we have population shifts where the population, a majority, or at least a lot of the population lives in rural areas. So how do we close that gap? And what we found is that digital technology and telehealth is a key component of that. Zoom, we've done some worldwide studies in countries that are along the different development scale as far as technology goes. And, one of the key choices and one of the key indicators about people choose which provider they use is, of course, access to care to that provider. About 88% of people, that's the number one choice. And then what we're excited about as we work with Life Health, and have discussions with, and work with IBM is the reality is that we know that healthcare organizations want hybrid models. We've done studies all over the world in 10 different countries. And sort of what it works out is that 50 to 60% of people who have actually had an experience of doing telehealth, they want a hybrid model. So if they need to come into the office for specific things, if in those of us that are in medicine, Dr. Sam, you relate to this, there's objective data where, and others on the call, you might need to look in an ear to see if they have an ear infection. You might need to do an ear analysis. And maybe that's not the number one approach for telemedicine. It might be in some cases. It might just say, okay, everything you told us with the fever, we think you have an ear infection, they can prescribe. But knowing and having a hybrid model of when to bring patients in and when not, that's what patients want. And I don't want to go too far on the business side, but it's also becoming a business driver. So if you're a provider in Uganda and you have another provider up the road who's willing to lower that barrier and that entrance point for people to get into the healthcare system, which is through telemedicine, where they don't have to drive 2 hours to see you, and they're willing to do that, but you're not willing to, then who's going to get that patient? Usually the one who offers the hybrid model of care. And where the real revenue comes in as we look at the business side of healthcare is when that patient maybe does have to come into your facility and they get blood draws, maybe they use the pharmacy, and that kind of has the business side of it as well. So that's another real driver in the field of telehealth. But why I'm excited today is a variety of reasons. We've ran the test. We see telehealth working and virtual care working around the world. COVID pushed us into that. But one thing I've learned at Zoom, as the guy who heads up healthcare at Zoom, is that the integration of virtual technology into traditional workflows that healthcare providers use is key. And that's why I get so excited about working with Life Health. Life Health has a very comprehensive solution, as you'll see, that you can use in your everyday practice when necessary. And as Michael said, not to replace what you're doing in other parts of your business, but you can use that workflow in a variety of different ways for other things. But then when you need to virtualize that solution to reach out and connect with people, the opportunity is there, but it still mimics the same workflow that you're using every single day. And we find that that is the number one indicator of success as far as helping organizations move forward, because it provides the ease of use and comfort for providers and efficiencies.